Good evening, ladies and gentlemen, and welcome to the School of Public Health's Community Dialogues. Tonight, we'll be talking about engaging communities of color for flu vaccine uptake by breaking through the COVID-19 misinformation. Who could have imagined we'd be in a situation like we are today? As we get ready to go to the polls in various parts of the country and a pandemic raging out of control across the country at the same time. What a better time to have this conversation. I want to welcome you all to this webinar. And let me set the stage for you. I'm Dr. Stephen Thomas. I'll be joined by Gloria Aparicio-Blackwell. We'll bring her on in a moment. And our moderator, Omar Neal from You Got the Power. Here's our lineup of our panelists. This is not going to be a lecture, this is going to be a conversation. And we have just a wonderful variety of people in this audience, content experts, scientists, people from the common walk of life, local barbers and stylists, and 194 people who registered from around the country. We're just so excited to have you here. And these are some of the speakers you're about to hear from. Let me just do a couple of housekeeping issues. We're going to be taking polls tonight. We'll also be taking your questions. We also have a special guest that will join us tonight, and that's Dr. Michael Osterholm. And he's going to lead the way into the barbershop. He's going to talk to our barbers and stylists about what they're hearing from their clients in the barbershop. And so you'll be hearing more from Dr. Osterholm as well. This is our contact information. This is being recorded, and you'll be able to do the follow-up with Gloria and I if you want to learn more about the other dialogues that are in the program description. And now I would like to ask Omar Neal to set the stage. And Omar, you haven't seen Gloria in a while. So we got Gloria back. And I think we should all be in the Hollywood squares, right?
Absolutely.
Yeah.
Gloria, it's good to see you. And Doc, it's always wonderful engaging with you. And this is a special time. Not only are we preparing, we hope that if you're not yet voted, you are preparing to go to the polls and vote. This is a critical time, and we expect that all citizens of the United States that's eligible to vote, that you exercise your constitutional right and get out to vote. So I want to get that out of the way. In fact, vote and remove all doubt. Let's start that.
Spoken like a mayor who's had to run for office, right?
Absolutely. This notion of the COVID-19 has created a lot of anxiety in this country. And, when you're talking about that coupled with the flu season, it can exacerbate our anxiety. And so I think it's important for us to get information because too often we have politicized this notion of science in a way that people are putting the pause button on their involvement in not only clinical trials, but also taking the flu vaccine. And so it's important for us to cut through all of the noise and get the true information out to people so that they can be comfortable enough to take care of themselves and their families. And this kind of dialogue is the foundation for that to take place.
Now, Omar, I want to introduce you to some really, really special guests for tonight. But I want Gloria to say hello to the audience, and then I'm going to share the screen.
Buenas noches, everyone. Evening, my friend. Long time no see you, Omar. What a great pleasure to be here with all of you. And this is critical. And you just said it. We have to exercise our civic duty, and voting is as priority. And we just finished the census, which was another good way to preserve democracy and bring in resources to our communities. So here we are again, and this is critical with this COVID-19 And with all this pandemic, we need to find that vaccination. We need to educate our community. So Dr. T, thank you for doing this. It's a great pleasure working with you. I'm from the University of Maryland Office of Community Engagement, and we engage the community. We really do, isn't it, Dr. T?
Sí.
Nuestra comunidad tiene que saber sobre la vacuna y lo importante que es. For the person that is doing the graphic about our conversation, I just said how important it is to our Latino community to understand what is at stake if we don't understand the process and what the vaccination is all about. So I'm excited to be here and hear what you got to say.
So like I said, this is a conversation. We're not going to be lecturing to one another, but I do want to introduce you to somebody who is bringing a nice and special skill to us. You've met Omar, former mayor of Tuskegee, Alabama. But also sometimes we run out of time. You need to know that we're also training that next generation of young scholars. So these are the students behind the scene making all this work, and their mentors, Lena Daniels and Tracy Kennedy, are the mentors of the young scholars you see down there. So give them a hand, give them a hand. And I really am excited about Emmanuel Nope. Emmanuel, you're on the screen right now. Just say a little bit about yourself and what you're going to do for us tonight.
Good evening, everyone. Good evening. It's an honor and a privilege to be doing this tonight. I am very grateful. Thank you so much, Dr. Thomas. My name is Emmanuel, as Dr. Thomas already said, and I'll be facilitating the discussion in a graphic way. So I'll be painting all the important concepts and the ideas that will come up from this meeting tonight.
So that meeting has started, Emmanuel, so turn around and start your drawing, and every now and then we'll go back to him and see how the drawings are coming along.
All right.
We also have a time-lapse camera on him, so we'll be able to take an hour and turn it into 60 seconds and see how he moves forward. So I'll come out of sharing my screen and give this as an opportunity for our experts to do a thumbnail introduction. And the way I want you to do that is simply, if there was a word that you had to characterize what the past week has been for you, what would that word be? And then give us a thumbnail about who you are. I'm just going through my Hollywood squares. Dr. Quinn.
I'm Sandra Quinn from the Center for Health Equity, School of Public Health, Department of Family Science. Stressful.
Gloria.
Anxiety.
Monica.
Hi, I'm Monica MacArthur from the University of Maryland School of Medicine, Center for Vaccine Development and Global Health. And I'm very excited to be here. And a word to describe my week is frenetic.
Frenetic. As I mentioned, Monica is the PI of the Novavax COVID-19 vaccine a phase 3 trial that's out now. And she'll be sharing some of the things that we're learning. We have Dr. Edward Ellinger with us from the great state of Minnesota. Ed, your word?
Dr. Learning. I've learned a lot in the last week. I'm the former Commissioner of Health in the state of Minnesota. I'm also the chair of the HHS Secretary's Advisory Committee on Infant Mortality, where we're making health equity the central focus of trying to reduce maternal and infant mortality.
Thank you very much. COVID has exposed the underlying health disparities, and I hope that they stay on the radar screen as we get through the crisis. Mr. Patterson.
Good evening, everyone. My name is DeJuan Patterson, and I'm an advocate and social impact consultant with the Bridge Advisory Group. I would say what described my last week, give me a little bit of anxiety.
Okay, and over the course of the evening, Mr. Patterson will share his story, his own personal story about what he has encountered and his mission around stopping issues around violence. We have legislators with us. Jocelyn Pena Melnick, I voted for you.
Thank you very much. I am very grateful, and it's an honor to be with you. I love your passion. My word will be encouraging.
We have the next generation coming up. Maggie.
Hi, everyone. I am a senior community health major at the University of Maryland, and I'm really excited to be working with Dr. Thomas and everyone here.
You got a word, young lady?
Oh, yeah, sorry. Yeah, I think a word to describe this week, I think anxiety is a good word.
Mr. Mike Brown from the shop, barbershop in our hair and health wellness network. Mike?
Hi, everybody. I'm Mike Brown. You just introduced me well. My week has been great. Everything is well.
And we have our own Dr. Ernest Carter, the health officer for the Prince George's County, Maryland. Dr. Carter, so glad to have you here.
Thank you. Thank you so much. I think my word would be hectic.
I can only imagine. And we salute you and all the other staff in the public health departments here in Prince George's County and around the country.
Thank you.
And I'm going through my Hollywood squares. Is that Lois? Millie. There you go,
Yes.
Millie.
Yes, hi. Hi, I'm Millie Tapia. I'm also from the University of Maryland School of Medicine, the Center for Vaccine Development. And I'm also working on the COVID-19 vaccine trials with Dr. MacArthur and our other colleagues here at the university. And my week has been hectic as well.
And so Millie is literally on the ground at one of the satellite stations located in the heart of the Latino community here in Hyattsville.
Very important.
Very, very important. And down in my lower left, I have one of our most famous stylists, Katrina.
Hello, Katrina Randolph from Trichet's Hair Studio. My word for the week would be stressful. Stressful, very.
Katrina's been with the program we're going on now 8 years, believe it or not. And Katrina is our first stylist that's been, you ready for this, Dr. Carter? She's now been grandfathered in as a certified community health worker. Give her a hand. Give her a hand.
Yes, and I'm so excited. I'm so excited.
So all the training that they went through in the hair training for health outreach, the county accepted as part of her training, and she was grandfathered in as a certified community health worker. Now they're working on the barbers, but Katrina is the first one across the finish line.
Yes, and I'm excited, beyond excited.
And we have our own Dr. Boris Lushniak, Dean of the School of Public Health. Boris, your word, and tell us a little bit about yourself.
Thank you, Dr. Thomas. My name is Boris Lushniak. I'm the Dean of the School of Public Health. Happy to be part of this team and dealing with all this from all sorts of different perspectives. Prior to that, I spent 28 years in the federal government, 27 years in uniform as a U.S. Public Health Service Commission Corps officer, served as a Deputy U.S. Surgeon General and Acting U.S. Surgeon General. So I've seen crises from that perspective, and now I'm seeing it from this perspective. And to a large extent, my word for the week is healing. And the reason I bring that up is 6 days ago, I had surgery on my foot. So I'm now on 6 days worth of crutches. It took me a while to get up the stairs and onto this screen today. But also, I hope that that's the metaphor for the healing that's going to go on in our society, in our incredible world of this syndemic, right? The world of COVID, the world of racism, the world of violence, the world of climate change. At some point, we have to turn this thing around. And I think forums like this are the beginning of that. Thank you.
And thank you. And I see up in my upper corner, Kristen Arabian, part of that next generation of public health professionals. Kristen, your word, and tell us a thumbnail for yourself.
Sure. Hi, everyone. My name is Kristen Arabian. I am also a senior community health major at the University of Maryland. I would say my word is hectic.
Okay. So sometimes acknowledging it gives us control over it. Let's hope so, right, Dr. Carter? So Maggie, go ahead and pull the first poll question. We have a poll we're going to put up. We'd like to ask you to go ahead and vote. We'll keep the poll open for a little bit here. Go ahead and vote. And everyone who can see this question can vote. That means the panelists here and the folks who are also guests who are not in the Hollywood squares can vote as well. And so, Dr. Carter, you should be quite pleased looking at these results as they're coming in real time, because so far, this group, and Dr. Quinn, you can talk about on the national level, this group looks like they are exceeding the national goals, but I'm going to defer to the experts here. You guys can keep voting. We'll keep it open for another few seconds, but we do see the trends already. So Dr. Quinn, you want to start first what you're observing here?
Well, I don't see the results, but if they're positive and we've exceeded, the 42% of Americans who got their flu vaccine last year, then that's an improvement. And I think Dr. Carter would say it, and we all know it, that, oh my goodness, 76%, woo! It would be critical any year because of the risk of flu, and particularly for people with chronic disease, the risk of severe complications if they get the flu. This year, it's not just about protecting our health and health around us, it's also about protecting our healthcare workforce and keeping people out of the hospital. And I'm sure Dr. Carter has some words of wisdom too.
Dr. Carter?
Well, I couldn't agree more, and it's particularly important with the COVID crisis here, because the combination of COVID and the flu is not a great combination. So it's excellent to see that folks have gone out and gotten their flu shots, and we're really encouraging this so that we can be sure that we can keep our residents safe.
Now that's our unscientific poll, but nonetheless, I was actually quite surprised at those numbers. So Omar, before we take them out and let them hear from the community, I'm going to throw the ball back to you to get this conversation started. We have some of the nation's leading experts. We have statewide experts. There's no shortage of expertise here, as well as the wisdom of the common wisdom of men and women who don't have all the degrees behind their name, but they know how to build trust and to keep trusting relationships. We need their partnership as well.
Thanks, Doc. One of the questions that I would have, although we saw 76% of the people, respondents said that they have had the flu shot or would take it. That's one thing, but I'm more concerned about the people who would not take it or who have some reluctance. And I'd like to throw this to Dr. Carter. When you find people who are hesitant to take the flu shot, is it based on their lack of trust, their lack of knowledge, or they're a combination of both?
Well, and it varies from community to community. It depends on the community, and sometimes it's a lack of knowledge, and it's really important that we impose the science and make sure that people understand the basis for why we're telling them that a shot will protect their health. Sometimes it's just a suspicion because of the historical treatment of folks, especially folks, brown folks and people of color, and some of the things that have happened as early, as of the 1970s, and the Tuskegee studies. There's been an element of mistrust, and it's still an element of mistrust. And so it really does vary. And I think that, from a practitioner's standpoint, it's building that trust. You have to make sure that you have trust in your practitioner, your physician, so that when you go to find out whether or not you're going to get a vaccine, that you understand that knowledge is imparted to you. So it varies from community to community, from what I've seen.
Dean, we talked about this before, but the politicization of something like COVID-19 or the flu shots or science can really hamper one's ability to garner support for the results or for the vaccine once it has been developed. Have you seen that to be the case, particularly in this hyper-partisan, hyper-political environment?
Yeah, to a large extent, Omar. This is part of the essence of our problem here, right? The whole idea is, who do we believe anymore, right? When and I'm going to be nonpartisan here, but when the president says one thing, when a public health expert says another, when some other party comes in and verifies either the first opinion or the second opinion, right? At some point, because we don't have a unified approach on this, which should be all based on scientific data, information, and our past experiences, what we lead is to a confused world. And that same confusion will reign as we enter the age of the vaccine, because we're going to be dealing with the issues like we're talking tonight is not only the vaccine trials, are all our populations, including the underserved minority, LGBTQ world, the Black, the Latinx, are they represented in the trials? And at the same time, when it comes time for us to sell the vaccine, and it's going to be a sales job, are we going to have buyers? Are we going to have people who trust what we're selling? And we're messed up right now. We got to get ourselves out of this spin, Omar.
Edward, they said that you have to make your friends before you need them. And so have we done a good job in outreach into those skeptical communities to foster the trust and legitimacy required for acceptance of vaccines and other vaccinations?
You know, Omar, we have one of the nation's leading experts on getting a pulse on that question from whites, African-American, and Latinx populations. Dr. Quinn, you got.
Hi, Dr. Quinn.
Come on, give it up.
So I mean, I think, the issues of distrust are, just as Dr. Carter said, I mean, these are not new. And not specific to the flu vaccine or COVID vaccine. But where we are right now, I think, in this kind of science environment is, are we as, our state health departments, our local health departments able to do, many of them have partners they work with for a long time from Latinx communities, Black communities, but they are so swamped by what they face day after day is, we need to, yesterday, and by yesterday I mean 6 months ago, we need to have started that process of engaging with partners, there's a saying in preparedness is you don't build your partnership after the crisis starts. Those partnerships, ideally, you've got in place because those are the folks, and community health workers, folks like Mike Brown, faith community leaders and others that we're going to need as trusted voices on the ground. And it can't start the day the vaccine's approved. It should have started months ago. And let me just say one other thing. I mean, I think, the whole country has gotten a crash course in vaccine clinical trials, something that goes on. Most of us have no idea how it works. We shouldn't expect the public knows how it works. And, we still have a lot to do even before we get a vaccine at, helping communities understand what those trials are, what they mean, what it means to participate in, what they're learning, why it's critical for Black and Brown communities to participate. We still have some work to do on that count as well.
So we have some people in the Hollywood squares, Dr. Quinn, who are out right now trying to recruit people. So let's find out what they're experiencing. Dr. MacArthur, you're running the Novavax trial right now as we speak.
Well, we're still getting ready to start. We haven't started yet, but we are looking to engage communities who are at risk for the coronavirus and at risk for developing severe disease. And we really want to make sure that the population who we enroll in this study and all of the vaccine trials is representative of the population who is affected by this virus, which means everyone. And we particularly want to make sure that we engage communities of the Latinx population, the African-American, Black population, other minority groups who are adversely affected.
Now, that sounds so inviting. So I'm going to look at Katrina and Mike, a stylist in her own salon, Mike in his own barbershop. You're seeing people every day. You hear Dr. MacArthur reaching out to our community. What are you hearing from people in the barber's chair and in the salon chair? Mike, you go first.
Well, you have a variety of people saying different things. Everybody's different. Some people saying, I've heard that, give me what Trump had. He was only sick for 4 days. He came back. I heard, I'm not taking it. I don't trust it. Some people are taking it and understand the science of it and trying to stop the prevention. And others are just, they just don't have the knowledge that they need to know. I mean, I don't think it's transparent enough for them to understand what's going on. And they don't comprehend what the shot is really going to do or trying to do. The majority of the people are really saying, you know, I'm not going to say I'm not going to take it, but I will not be the first one to do it.
And we know that women play a major role when it comes to health issues in the family. And Katrina, you've got a whole lot of moms, wives in your salon chair. What are you hearing?
Well, I'm hearing a lot of different things. A lot of clients, like Mike is saying, just to piggyback off what he's saying, they don't trust the vaccine. They're not knowledgeable enough. They believe that Trump is falsifying the information that he's putting out there about trying to find a cure for the coronavirus. And a lot of people are just saying they're not going to take it, you know, but we should take it to prevent it from spreading any further.
Now, Millie, you're just hearing from folks who have a trusted relationship with the very population you're trying to reach. What are you experiencing, Millie, out there as you're doing recruitment?
So it's interesting. I think, you know, first of all, many of the people that we recruit have already expressed an interest. So they're already open to the idea of being in a study. And by and large, the majority of them are ones who are willing to participate once we explain all the details. The ones who don't participate after hearing all the details are interesting. Some of them have said, wait, there's only a 50% chance of getting the vaccine. I thought I was gonna get the vaccine. I don't wanna be a part of this. I wanna get it. I don't wanna not get it and do all this work. Others seem to take the other stance, which is like, oh, there's a 50% chance I'll get the vaccine. I don't know about that. And so they're still hesitant to participate. And then others are just, you know, concerned about side effects. They're concerned about who's going to take care of them if they have any side effects and what the long-term effects of those side effects might be for them. So we get a lot of questions, but, you know, again, you know, I'm not trying to convince somebody who isn't convincible, if you understand my meaning, because these are folks who have reached out to us. So I think that certainly Katrina and Mike's experience is much more representative of the general population, because just again, we're seeing again, a sort of a primed group of people, but we still get very interesting interactions. I think many of those who want to participate are interested in helping. They're sick and tired of the situation that we're in, and they want to contribute. And this is how they see, you know, their ability to do so.
And so,
Steven.
Go ahead.
Yes, so I just want to say that, and that is true, but that we need to provide information to the communities for them to make those decisions. But the other thing that I'm hearing from the community right now is that the nonprofits, the faith-based organization, all these entities that wants to get people in their trials and are bombarding our nonprofit organizations. So I'm asking all of you that from this point on, start building relationships. That is not just right now in the midst of this crisis that, oh, we think about we need to be going in the community. And then once we do the work, we are poof, be gone, and we never see them again. So I think it's critical that it is important to maintain that level of relationship, that this is not just with pressure that we get this information out, because people are going to be mistrusting the whole process. You haven't talked to me before about all of this, and all of a sudden everybody wants us. So they get saturated and then might not be part of the trial or even to take the vaccination.
Yes, that's a good point. Yeah, I'm sorry, Dr.
So,
Todd.
no, Millie, go ahead. I
yes,
wanted to kind of ask the question, probably to piggyback on this. How important is it that you have diversity in clinical trials for the efficacy and safety of the trial to be universal? That I want to know how important it is. Is it essential or not?
It's essential because, you know, everyone is different, and we need to make sure that the vaccine is safe and efficacious in the populations for whom we want to give the vaccine. So having representation is very important.
Okay.
So Omar, I want to really salute Monica MacArthur and Millie and the team, because one of the things they did was to put a COVID-19 vaccine clinical trial satellite office literally in the heart of the Latinx community. It is literally surrounded by dense housing, a location called Casa de Maryland, a nonprofit that people trust, and that's where they're headquartered. That really helps. Now, there are some limitations on how many satellites they can have, and this is why we're in the barbershops to help recruit on the African-American side. But this might be a moment to take them into the shop to actually hear from the people you're trying to reach. And I'm so glad that we have Dr. Michael Osterholm who's joined us. Mike, can you see us here? Let's make sure we can hear you. Just unmute.
Yep, I can, thank you. How are you? Good evening.
Very, very good. So happy to have you here, and
thank you.
Love your podcast and what you've been doing to raise awareness about these issues in minority communities. And you can, on the other side of the short video I'm going to show, speak to why is it important to have racial and ethnic diversity in these biomedical clinical trials. So I'm going to do a screen share. It takes a little bit of a moment, but Mike, while I'm setting this up, why don't you give a thumbnail? We ask people for one word that characterizes their week, and then a little bit about who you are while I set this up. You have the floor, my friend.
Fragile week. What we have right now, unfortunately, is an unfolding situation where we're going to see over the course of the next 12 weeks or more, really the darkest days of this pandemic. This is a huge challenge. We have a combination of pandemic fatigue, people who do believe the pandemic's real, but just feel like they can't continue to isolate themselves or reduce their contact, and it's manifested in outbreaks in weddings, funerals, school-related activities, etc. And then we have a very growing and ever-growing and very seriously challenging group, what I call pandemic anger. People who do not believe this pandemic is real. They think that, in fact, it's a hoax, that it'll go away on the day after the election. And they will not participate in any kind of public health activities to reduce the risk. And then you blend that with indoor air, that now frequently encountered environment that we're leaving outdoors as it gets cold, like it is right here in Minnesota. And you combine those three, and we're going to see the number of cases go up precipitously. You know, here we are at 75, 85,000 cases, and that's just the beginning of the climb. That's per day. Wait, it's going to be a challenge. So we need these vaccines soon, and we need them to work in the populations that are most impacted. And I couldn't be more pleased and proud to be with this group tonight, because you're at the heart of what we need to do.
Now, Gloria set the stage for us very nicely. She's saying, hey, our communities are now being inundated with folks who now they love us, they want us to join things, but where were you when we were having all the health disparities? And so now we need to take the time for the long-term relationship building. So I want you to hear what's happening from the people in the chair in Mike's shop, and if we can answer any of the questions that we're hearing. So Bim or Omar, do I have a full screen, Omar?
You have a full screen.
Okay, here we go. Buckle your seatbelts.
This is my good customer, Jim. Been cutting Jim for over 10 years. This is my customer, Kyrie. I've been cutting him since he was on phone books. This is a new customer, Ty. This is my customer, Jason. This is my first time cutting his hair. Jason, we just asking the people, how you feel about the flu shot?
They tell you it's like I'm assuming it's like a dead virus or something that they put into you.
Honestly, I feel like it's another way for the government or the pharmaceutical companies to just get more money. In my opinion, I always just was anti any shot that I ain't need, even shots that we used to get for school and shit.
Personally, I've always taken a flu shot. Just the idea that you gotta prepare for it. Always thought that's always good.
How you feel about the flu shot?
I never take it.
Why not?
I just never do, and I never got the flu, so.
I just had my flu shot taken last Friday, so yes, I would take that.
Because they haven't gotten a flu shot before, so why should they get it now? Not only that, they're injecting you with the virus. No, thank you.
That they don't know how it's going to affect your body. Everything's not for everybody. You know what I'm saying? So just because it might have cured this person don't mean it won't mess this person's body up, chemical reactions or anything.
As far as the president, what he said, I don't trust him.
I definitely pay attention to what Fauci says. So if he says it's good, then I'm doing it. If it's a no from him, then it's a no from me.
Thanks a lot.
Okay.
All right.
Okay.
All right. I appreciate it, Joe. All right. There it is.
I just love that ending. There it is. All right, there you
have it. It's a no for him, it's a no for me.
Yeah. Dr. Fauci may not even know he's got agency in the hood, in the barbershop. And I told the barbers, Mike, the president hasn't attacked you in the same way, so they don't know your name yet, but they know you tonight. You're here with them right now. I'm gonna let you take the first shot at it. What did you see? What did you hear? What did you observe in that short clip?
Well, I observed people who have realistic and real concerns about the safety of a flu shot. And one of the problems we have in public health today is we don't tell a very good story. You know what? We give people, directions. We tell them what they must do or why they must do it, but we don't share a story with them. And if they could see the story that I see of the people who die each year from influenza that wouldn't have to die, people who are hospitalized, seriously ill for days and days and days. And then I talk about the fact that my good buddy, Tony Fauci, who I just talked to today, would say, yes, yes, and yes, get that shot. He already has his, by the way, as do I. I have mine. And every one of my loved ones has their flu shot already. And what we need to do is explain to them how the flu shot works. Take some time. Don't just say, get it. Explain that it's not a full virus, that in fact, it's just a part of the virus that will then make your body react as if it had seen the full virus. And therefore it can't give you the flu. It can't make you feel, flu symptoms like you get with real flu. And the last thing I would say to them is, when's the last time you were walking across the street and a pickup truck at 30 miles an hour ran you over? And they'd say, well, it's never happened. I said, well, then you just wait and get the flu because you'll know what it feels like. Okay. So that's the kind of story we have to tell them. We have to help them understand why that's important. And I for the first would say we haven't done nearly a good enough job doing that.
Go ahead.
Yeah, Dr. Osterholm, I would like to know from you, what level of knowledge did you need before you knew that it was okay for say a COVID-19 vaccination? What level of assurance would you need, and what would constitute that level? Now, the flu shot, that's something you know about and dealt with before, but we're talking about something very different when it comes to COVID-19. What level of assurance would you need, and how would you get that assurance?
Well, I happen to be very fortunate, and this is part of my business. So, I get to call the balls and strikes on this one for myself because I understand how to evaluate these vaccines. I look at the safety, I look at the effectiveness, I look at, what is the long-term issues with the vaccine. I look at what are the short-term potential reactions. And I, would say to all of you, without hopefully sounding too verbose, but if I get it, get in line with me, because I'm telling you, I got a great deal for you. Okay. And I'll go first. What we need are people who are trusted people in our communities, like Tony Fauci and others, who will stand up and say, I'm not going to wait for this any longer than I have to. I want it now. I don't want to jump in line to the people that need it before I do, because there are people who will need it more because they have a greater likelihood of getting sick. But basically, I will look at the data on how safe it is and how effective it is. And I will be very happy to share that with you. And I must tell you, you know, I'm skeptical like everyone else. I want to see the data, and that's when I'll tell you it's there. And I hope that we have others that can trust us and members of the community that can be trusted to say yes now.
Now, Omar, we have two health officers here. We have Ed Ellinger, former health officer for the state of Minnesota. We have our own Ernest Carter, health officer here in Prince George's County. Almost 1 million people in this county, 65% are African American. And for the two of you, if we don't have people willing to take the flu shot, which is already safe and effective, do you actually think we can get them to sign up for or to take a COVID vaccine, a COVID-19 brand new warp speed vaccine?
Well, Dr. Thomas, let me take a shot at that. And I'm going to give you a little bit of history. Today happens to be the birthday of Jonas Salk, the polio vaccine creator. And I remember, I'm old enough to know that when that vaccine came out in the early 50s, there were some problems with a couple of the doses or batches that came through, and they had some adverse reactions. But they did those, they corrected those, but yet there was some hesitancy in my hometown about people getting the vaccine. My parents took the lead and got all of their kids vaccinated. And from that point, their neighbors said, oh, if the Ellingers did it, it must be okay. So it's those community influencers. And that's why I really love the fact that you have here people from the barbershops and the salons who are community influencers. Because what I heard in that videotape was trust. Who do you trust? And if you trust somebody, if you trust the messenger, you will follow the lead of that person, the community influencers. We had the same situation here with the Somali community with measles vaccine. Only when we got the imams and the mothers who are community leaders to say, yeah, this is a good thing to do, were we able to turn the tide. And we have to continue with those community influencers. It's not just a one-shot deal, pardon the pun, but you have to continually be in relationship with the community, the people who are making influencing behaviors. So this is an ongoing effort, not just for flu, not just for coronavirus, but for all of the things that come down the road. Because as Dr. Osterholm knows, there's going to be many more of these infectious diseases coming down the road that we're going to have to deal with.
Dr. Carter, in a county of 65% African American, almost 1 million people. I don't know what the number is off the top of my head for flu uptake, but that's a marker for whatever else we need people to do. What's your sense, sir?
Well, I absolutely agree, and I will tell you that the whole idea of trust is essential in all of healthcare. And vaccination is sort of just emphasizes it, but that's true all across. And when you're doing healthcare in general, and when we've done projects in the community, if you don't build a trust first, then you're not going to be able to get success with your project. Just like you, Dr. Thomas, you built trust with your projects, you can see the results of it. And so when we do projects in the community and we build trust, if we don't follow through with those projects, then the community loses trust with us. One of our biggest problems in terms of public health, for what I see, is our health literacy is underfunded and not done. Health literacy helps us get from where we are now to a trusted community. And I advocate that because I believe in it so strongly. And when it comes to a vaccine, there's a lot of stories. I think that was a great segue into saying that we need to be telling our story. So one story to the next person, so they'll start to understand and trust whether it's the flu vaccine or all of the things we do in healthcare, taking care of diabetes, hypertension, So I am a big advocate of that, but it takes resources and energy. And sometimes we have one without the other, if you know what I mean.
So we have
Dr. T, let me ask you something quickly here. so you're mentioning here the importance of the key community leaders that can be the influencers. Could you give us some examples of the kind of the message that they need to, because we know I have 200 people right now in this call watching this, and I know we have community leaders. How do we empower them right now to go back and talk to their community? Is anything that they need to be looking at? Because they're no expert, but we can provide them with a messenger. What is it that they need to be looking?
Now, who are you throwing that question to, Gloria?
I'm throwing it to Mike. I cannot remember his last name, but I know that, and Dr. Ellingberger, yeah, Mike and Edward.
Okay, Mike, you see you've already been bonded into the group here.
I feel honored. But let me just say that, you know, as much as I feel wonderfully bonded in the group here, I'm an outsider, and I know that. The key message is it's got to be the insiders. It's got to be people that you know for more than just coming into town to tell you, trust me, and then tell a story and leave. It's the people who are there day after day. It's the people who people know in the good times and the bad times, in the, you know, the rainy days and the sunny days. And so building those kinds of leaders, this is where you build from inside out, not outside in. The outside can help, but they can't do it. And so I think this is exactly the kind of program that in my mind is doing the building from the inside out. So Gloria, I'd have to say that that's the key message here right now. We all can help, but we can be a part of the solution, but we're not the critical part. The critical part sitting right here on the screen. That's what we need.
And I think that part of it, people trust their healthcare provider, be it a nurse practitioner or the community health worker or their physician in their community. And so they need to be educated and they need to understand what's going on. And then they can educate the community influencers. You know, so it is one of these things that this is not like a sprint or a marathon. It's a relay. You pass information one to the other. And so you start, this group in particular starts with the healthcare provider, broadly defined, not just the physician, but the nurses and the nurse practitioners, the community health workers, the interpreters. Those are the people who get the information out. They're the ones who trust and then pass it on.
Let me ask the question, and this is to the group. You know, oftentimes when people are watching like a game and they see where the referee makes a bad call, the whole group said they cheer against it and they jeer and they say, you know, you're wrong, right? Because they saw it was a bad call. Now, because scientists and people in the public health arena oftentimes do not want to be political, so they become apolitical. A lot of times they are silent, even when they hear bad information going out. Do you believe in this time of hyperpartisanship and bad misinformation going out, there needs to be a more forceful, unified message from people who know, practitioners, public health people, medical people, all of these great minds saying this is true, this is false. You know, it cannot just be Dr. Anthony Fauci. It has to be other people as well. Have there been kind of an abdication of people speaking out and being forceful in it?
Well, you know, if I could respond to that, I mean, I think that is a very, very important point. And, you know, none of us like to get into the middle of controversies just to get into them. But, you know, let me just say that I think that we can and must today have people that can call balls and strikes and do it with a great deal of sincerity, and they can take on the issues. You know, I've served roles in the last 5 presidential administrations, including I was a science envoy for a year for the State Department for this administration. I served 2 Democratic governors, 2 Republican governors, 1 independent governor in Minnesota at the State Health Department as state epidemiologist. And I dare tell people, what are my partisan politics? You know, I've always just called balls and strikes, but boy, there are some people on this screen that can tell you, I'm not afraid to stick up and stand out and put my head out, okay?
That's why you're here.
And call it like it is. So
Right.
I don't think that the two are mutually exclusive. And I think the point you're making, though, is really important. We can't just speak up when it's convenient. We have to speak up when it is the right time based on what people need to know. And if there's misinformation going on, it doesn't mean that you get into a shouting match or that you are disrespectful, but you don't hesitate to stand up and say that this is what it is. And I think that's something we need to do. And it doesn't matter which community you're in, you need to do that.
Now, Katrina and Mike are influencers. And I've always said, whatever we do in the name of bringing health professionals into their spaces, I call their spaces sacred spaces, that whatever we do, we shouldn't break that sacred space. So we don't put them in a position to give medical advice. We put them in a position to say, I can call Dr. Boris Lushniak, the Dean of the School of Public Health, and he'll come out here to the barbershop. That's the kind of relationship they have with the university. But it is not easy, correct me if I'm wrong, Mike and Katrina, we'll go to Katrina first, well, what's your approach? You listen, you hear the information. Are you having to twist people's arms, or what is your sense of the lift that we're faced with, and we're going to turn?
I think it's important that as part of the health network and now becoming a community health worker, it is really our job to go out and get this research for our client base and understand what's going on as far as the coronavirus is concerned. So when our clientele sit in our chair, we can kind of have dialogue with our clients to kind of not really convince them, but kind of talk to them and be knowledgeable about what's going on, because a lot of people just don't know. So me as a community health worker, if I'm knowledgeable enough to have my client sit in my chair and be able to give them dialogue about what's going on and kind of make some of them understand that don't really understand, then I think that would kind of help them make wise decisions and more healthier decisions.
Big Mike?
I believe that, some people you can speak to, and some people you have to show the fact to them right there. If something like an adult book, like with the coloring illustrations of really what's happening with the shot, like page 1, like talk to them like a 3-year-old and explain it to them in the book, page 1, the shot, page 2, the injection, or something like that, to show them, just to have total transparency, to let them see what's going on. I think they will probably understand it and get a better grasp of it, rather than just to lean into their own understanding and make their own conclusion with no scientific fact behind it whatsoever. And I think if some of my clients will go back and look at this video after they're enlightened, they'll be embarrassed at what they said on the screen.
Essentially, Mike Osterholm, what is it that you heard in the barbershop that you can say that wasn't quite right? Can you think of anything specific that you heard that if you could enlighten that person, you would tell them something different to change the way they think about it?
I have heard frequently, including potential barbershop language, that this pandemic is going to end next Wednesday, the day after the election. That it's all about the politics, without really understanding that no, it's not. And I've even seen situations of families who have lost loved ones to COVID, but because they believed that it was a political issue, they found their own rationalization to say, well, my grandpa died from pneumonia. He had the COVID, but that didn't cause it. It was the pneumonia that killed him, and tried to minimize that. So I think that's a big one right now, people trying to make it go away for whatever reason it is. And of course, we all know that that's not the case.
Go ahead. Who's talking?
Omar, I just want to go back to Mike, because he gave us a solution I don't want to get away from. He said, let's take this information, demystify it. He said like a 3-year-old, there's your health literacy, Dr. Carter. But we're working on the equivalent of a graphic novel that takes that CDC mitigation information and puts it in a graphic form. And let me ask Maggie if she'll go ahead and pin our graphic artist just so they can see where he is right now. We have a digital note taker, Dr. Osterholm. And
yeah, I see it.
Yeah, he's going to just do this, but it is in this way that we try to meet people at the different levels of their learning. Some people learn visually, some people learn by listening to a lecture. We need the whole range of learning styles to solve this problem. And COVID could be our opportunity to do that, where we haven't been able to do it in the past. Now, Mr. Patterson, before we go to the next poll, you're a millennial. Talk to us about those 30-year-olds. Are you invincible? Do they believe they're simply not going to catch anything because they're invincible? Talk to us.
Absolutely. Coming off straight honesty, coming from a generation where we are accustomed to seeing our peers not suffering from the flu or not having the need to get a flu shot, they believe that, hey, this can't happen to me. And some of the things that were already mentioned was centered around trust. And trust is based upon, for some people, is built on the ability to predict future actions similar to past experiences. So if people cannot trust you or see that there's a level of predictability in your words or your action, then they're not going to trust you. So with that being said, there's a lot of misinformation circulating in the digital world, which we are accustomed to being in right now. And there's little demythifying a lot of the information. So now we're doing a lot of peer review. Who's talking to me that's close to me, and I could trust and believe that their information that they provide me is true. So I hear a lot of my peers talk about they won't test on me. I will take my chances with getting the flu. And now that we're seeing a lower positive infection rate, a lot of us think that it's over. And like we just mentioned previously, with the cold winter months coming up, we might see an influx. But millennials, similar to coming off that 20 and early young age, you think that you can't get hurt, you don't get injured, you don't have to go to the doctors and stuff like that. So that's a lot of the sentiments that I'm hearing right now.
Hey, I remember when I used to think
add,
that.
Can I add something to that? This is a really very important point. Following up on that, right now, one of the yet really only emerging issues around COVID-19 is a condition we call long haulers. This is a condition that's occurring among particularly young, healthy individuals who get this infection, who have very mild illness initially. And we're seeing up to 20% of all the infected individuals at 5 to 6 weeks having increasing disability due to severe fatigue, brain fog. Some of them are on 100% oxygen at home, not able to function. And if we could help tell that story and say, you know, you might not end up in the hospital in the intensive care unit, but do you want to spend the next months in your life at home on an oxygen tank, basically having this very severe issue? And that's a storytelling issue again. We need to tell that story, because I don't think most people know that. They don't realize that that's a very major emerging part of it. So I think when we just heard that just now about, you know, it's not going to be my big problem, I think this is really, really an important consideration.
You know, trust is a calculated risk, and that's critically important. And I think what was said earlier is very salient. The other thing is too, let me just say in Alabama, we literally determine your political affiliation by whether or not you wear a mask or not. That's how, you know, that's how serious it has gotten. Where if you wear a mask, then you must be leaning liberal, democratic, and if not, then you are Republican, conservative. And until we can depoliticize this process and talk from taking care of each other, we are going to continue to have this problem even past the election on the 3rd.
Now, Omar, Gloria, you talk while I take us back into the barbershop to hear what the people think about COVID-19 vaccine trials. So you got the floor until I get set up. Go ahead, Gloria.
Say that again. I'm sorry, I didn't hear you.
I said you got the floor. Was that you trying to talk?
Yeah. Yes. No. I wanted to say something about talking about political environment. We have one elected official in our call here, who is Jocelyn Peña Melnick. And this also is going to take the support that we get from Annapolis to get the vaccination to be distributed to the communities that need it, besides convincing them to take it, or not convincing, but making the case for them to take the vaccination, but we need the vaccination. It's not an easy process. So I think the elected officials have a lot of work to do on that regard, particularly for our underserved communities that have been impacted heavily by COVID. So Delegate Jocelyn Peña, mi amiga Jocelyn Peña, ¿qué vamos a hacer?
You know, it's interesting. I've been listening here for about an hour quietly, and it actually, you know, it's all the providers are important, the health officers are important, the doctors are important, University of Maryland School of Public Health is important, but it really starts with us, honestly. And we actually had a meeting today. The General Assembly put together a COVID-19 legislative work group when we adjourn. And as you know, we adjourn early this year on March the 18th, when we usually go until the second Monday of April because of the pandemic. And we passed a lot of emergency legislation, and the governor issued a state of emergency, which we're still under, right? And the state is actually in phase 3, but the governor allowed the different jurisdictions, which we have 24 jurisdictions, 23 counties in Baltimore City, to kind of move at their own pace. So Prince George's, where we are, is in phase 2, because Prince George's County, out of the 24 jurisdiction, is the one that has the highest number of COVID-19 cases with over 30,000. And the Latino community, zip code 20783, has the largest number of COVID-19 cases in the entire state, with over 3,000 of them, right? So it's a Black and brown community. So this morning we had the Department of Health, we have Pharma, we have University of Maryland, right? Come in, and health officers testify in front of us, which are all the vice chair, and I'm a vice chair, and all the chair of the committee. So there's actually 24 members and some Republican minority leaders. So you have the bipartisanship. And we met and we had very tough questions for the department, because the Department of Health is the leader here. And they're actually submitted a plan to the CDC where they're going to have 2 phases. And they have already determined who's going to get it in Maryland, although they're in discussions as we speak. And that's going to change, because today we had questions of the department. And the department have, for example, phase 1 priority groups. They have high-risk healthcare workers, they have first responders, older adults, then they have the judiciary, then people in prisons, in the jail, and then people with underlying conditions. But we asked the question, where are the teachers here, right? And most importantly, where are the Black and brown community? And they did discuss it briefly, where they should also have priority, because we're the people that are most affected. So it really starts from us, Gloria, to at that level, the governor, the legislature, and the CDC plan, and then working with all the partners in the community. Because as someone that was sitting in that barber shop, he said, if Dr. Fauci says yes, I do it. It is the trusted source that matters, working with the churches, with the School of Public Health, with leaders, and with nonprofits. It's going to take all of that, and it's going to take money. Like the Department of Health cannot expect to do it for free. And the University of Maryland, is going to go out there and just go with a message. No, they have to put money into a media campaign, money across different platforms, digital, print, broadcast. They must give money to the university. They have to give money to different nonprofits for us to have a great message, because it has to get out there. And then afterwards, we need to really establish, meanwhile now, an external and internal clinical advisory group, people like yourselves, to advise the department and to advise legislators as well. So it's a lot of work, but we're doing it. And we held them today. We asked very tough questions from the Department of Health, and we meet every 2 weeks. So we're not sleeping on the job. We're going to keep, working on it and make sure that we do it right. Because we know, like New York, the governor has already said he's not going to trust the vaccine unless his experts say it's safe, signaling to the people in New York, look, we're going to go the extra step and make sure it's safe for you. And I think Maryland needs to do the same as well.
So Jocelyn, just imagine what you've just said. There was a time when we looked to the FDA to provide that kind of national oversight and assurance. And now we're having it break away. New York's going to have a separate one. The National Medical Association is going to have its own separate review. The fragmentation, I like that it's raising awareness, but it potentially, again, undermines a national response.
But that's because, if I may, with all due respect, and this is not a partisanship thing, so please, this is me just talking, not Dr. Thomas or not Gloria. It is because of the leadership that you have right now, because so much emphasis has been placed on making it quickly, right? Like, we've been at this for 10 months. It usually takes 10 years to develop a vaccine, and we're rushing it. So because the politics have come into play, that is the reason why people are not trusting it at all. I mean, he was promising it before the election, November 3rd. So that's what happens. I think politicians we need to stay in our corner, respect the lines, and allow the, educated health people to make the decision.
Calling it warp speed doesn't help either.
That's right.
If I could step in here, though, I think this is one of those times where you're asking me to challenge the system when it's not popular or convenient. I have had as much skepticism as anyone about how the FDA might have been approaching this. Clearly, they made mistakes in terms of how they dealt with therapeutic agents. But I am also incredibly confident at this point that the problem that we thought was going to happen didn't happen. And that is that the White House would put its thumb on the scale and move a vaccine out quickly through what we call emergency use authorization against the judgment of the FDA and get it out there just before the election. And that hasn't happened. I think the FDA has performed magnificently on this issue. They have really done their job. They are doing their job. And there are many of us who have been skeptical, who are watching it carefully and closely. And this is a time for us to rally behind them. I actually have complete faith in the FDA. At this point, the process they've undertaken, the outside review they're having done, even to the extent that we just had 2 vaccines put on hold, one for more than 5 weeks in terms of recruitment. And that was a good thing. You know why? Because it showed they took very seriously every one of these adverse health issues and to determine whether or not it had to do with the vaccine. And I am completely confident that they came up with the right answer and said, no, they didn't. So I would urge that this is a time, and there are not a lot of them like this right now, where we need to come together and support the FDA and say that if they continue to perform as they're doing, we are getting world-class review. It is about safety, it is about effectiveness, and I trust that this process is working. And that is part of the story. Then we can go out and tell them, you know what, the FDA did their job and they did it really well. I think these states right now are duplicating things that they don't have the expertise to do, and they're only going to slow down getting the vaccine to the people. So I actually am opposed to these other states getting involved. If FDA was dropping the ball, I'd tell you in a heartbeat. They're not. They're doing their job.
But
So,
if I may,
yeah,
the problem is that because you're inside. So the what we need to do as leaders in the community is to come to the community and just what you said, break it down into a story and words that people can accept and trust. Because
that's why I'm so glad
they're hearing otherwise, right? So that's that. In there lies the problem, like right there. Like, we need to make sure to tell people, look, that Dr. Fauci, people that they trust, people,
yeah.
I hate to say it, public health officers, Oprah Winfrey, people that people trust, role models, Casa de Maryland, people that will come out and say what you said.
And that's why I'm on this tonight, because you are the perfect leaders. I feel lucky to be working with you.
So I'm gonna let the voice of the community speak one more time, because you'll get an idea of the challenge and the opportunity we have. This episode we call the COVID-19 vaccine episode.
This is my good customer, Brian. He's been my customer for years. This is my good man, Jonathan Fox. This is my customer Marcus for over 10 years. This is my customer Corey. We've been my customer for a few years. This is my good man Larry Brothers. Will you take the coronavirus shot?
Nope.
Why?
Because it'll kill you.
How you know that?
Because it killed I ain't gonna say millions, but thousands and thousands of people.
I mean, I want to see what the how it works, because you have so many different companies that are coming out with vaccines under different nations, under different levels of pressure in terms of let's get it out.
I'm not gonna take that. I gotta see how it affects other people. Then I make that decision.
Vaccine. That's supposed to. I don't know if it's supposed to. Is it you throw the mask away after you take the shot, or do you social distance over? I don't know anything about it.
It's a good question. I personally feel like I said, another way for them to capitalize on this entire pandemic.
I believe that my body building antibodies against something is going to protect me better than putting a virus inside of my body, because that's what the flu shot is, and that's what this antivirus was supposed to be. I'm not doing it.
Okay. If people like Dr. Fauci said, put his okay on it, but as far as the president, what he said, I don't trust him.
But he just took some stuff, had him back in a week.
Yeah, but we not gonna get the stuff that he took.
Right.
Not the coronavirus.
Why not?
Because it hasn't been tested at all. And even when they came up with the polio shot, I mean, that was like 20 years.
So
I definitely won't take that.
Why not?
Because I don't feel as though it's safe. You know what I'm saying? We don't know if the medical administrators are telling us the truth about this thing. I mean, who knows what's in this thing?
Yeah. So we just take our chances how we've been doing.
I mean, with me, not with everybody else. I'm just speaking personally.
Thanks, Pop. All right. Okay. All right.
There it is.
Yeah.
So you see the climb we have. And Katrina, where's Katrina? Katrina.
She's here.
You see the climb and the convincing. It's another long-term education opportunity for us in the barbershops and the salons. You think we can do it, Katrina?
I think we can do it once we get our president out of office, because when they think about who's leading the country, if they can't trust him, how can they trust the vaccine? Even if a scientist is doing his vaccine, we're walking behind a leader that's not even leading by example. So it would be hard for a lot of people to even trust the vaccine. I think that's why a lot of people have questions about even taking the vaccine.
Edward has a question or a statement.
Ed?
Yeah, I'm not surprised at what I heard on that video. We're expecting a lot from people just to accept something out of the blue. We have not educated them well enough. People are not health literate. And I think this really reflects the fact that for probably 40 to 50 years, we've underfunded public health. We have downplayed the importance of public health and put all of our efforts on that individualistic medical care model. And this poorly educated population that we have, not just in your barbershops, but in my neighborhood here in Minneapolis, just the same way. People are not educated well enough. And I think as we see, 27 state health officers have resigned or been fired in the last year because of the people not trusting them and threatening them. We have to really rebuild our public health system in order to be able to move on things like vaccines when they come along and have people accept them.
Let me add this question.
While you're doing that, Maggie, put up the next poll while we're doing that. Go ahead, Omar.
You know, one of the problems is once you get the vaccine and let somebody help me with this. Are you permanently inoculated from the virus, or is there some period of time that you can be re-exposed and vulnerable? Or do we know that?
We don't know yet. We're still working on that. We know that you can likely be protected for the short term, but how long that protection lasts is still up in the air. And that's one of the things we'll be doing, is looking at studies of people month after month after month after they've been vaccinated. We may be back to a point one day of giving booster doses like we do for influenza each year. And that part we just don't know yet.
I'll show
I
you.
have a question.
I'll show you the quick results on that poll. Keep talking. Go ahead.
Dr.
I
T,
have-
there are questions in the chat asking about, is there any way that to find information about the vaccination or the process of in a simple and easy way to understand? One, and the second one, even if you have children's book that address vaccination.
Dr. Quinn?
Yeah, Gloria, that's really important. One of the things, I think there are a couple of things we can draw upon here that start with explaining the clinical trials and also what these vaccine trials look like. And I put one in the chat earlier. The COVID Prevention Network is out at the University of Washington, and they have expert panel groups representing Latinx, Native communities, older adults, and African American and Black communities. And so there's been a big effort. There's a faith initiative to build engagement in the clinical trials, but there are also some videos, and I dropped one in, some videos on why participate, why diversity is important in clinical trials, and also one's talking about the vaccine itself. But let me just say, I mean, you know, sitting on one of those panels for the last several months, and today I did 2 interviews of people asking me about, should we have these independent state reviews? And I'm actually with Dr. Osterholm, and I wouldn't have been there a month or 2 ago. But, you know, number one is one of the things I've learned about this process, and that I think we just can't expect the public to know these things, is there are a lot of independent reviews built into that process. You know, the public wouldn't know that, they'd have no reason to. But there's a lot of independent reviews that provide a check on the researchers, provide a check and look at that data independently. And that's critical. There's other independent reviews before it goes to the FDA for decisions. So I think we've got a lot of work to do to educate people about the trials, but we also have a lot of work to do to educate people about these vaccines, because there are multiple vaccines. They are different, they're made differently, and they have different dosage requirements. So I've been arguing for months, we can't wait until that vaccine is available to have that conversation in ways that people can understand, you know, that, you know, are not speaking to Dr. Osterholm, the scientist, but are speaking to, you know, people who just, you know, are new to this. We got to start talking now about that.
Dr. Quinn, look at the poll results. If a COVID vaccine was available now, would you get it? And now we see in this audience, I'm at, you know, 21% said definitely, 29% probably, 33% probably not, and 17% definitely not. If we broke that down by gender and race, we might find, again, important groupings. And believe it or not, this has gone so fast. Let's check in with our visual artist real quick before we give you closing comments. Go ahead, Maggie, and put him up there. There we go. Okay, look at him using his creative imagination. And Emmanuel may help us with that booklet. How are vaccines made? Are they safe? Answering people's questions in a visually compelling way. And so we are 3 minutes over. We're going to close out Omar. I want to give Dr. Osterholm the last word. We've asked him to do one of his poems, but let's go through the Hollywood squares and just give a closing comment from our panelists. Omar, I'll let you call on them.
Yeah, let's go with you, Sandra, first, and then we'll just move around.
You think I've unclicked that mute button 1,000 times already today, I would have noticed it, right? So I think critical, we have to hear the stories from people who have experienced this disease. It is a dreadful disease. And a lot of them are Latino, a lot of them are African American. And so we need those stories, and we need to build on what we know is already there. And that is a norm that says it's important to look out for your families and for your community, right? That's a critical norm in both Black and brown communities. And we have to build on that so that when we get this vaccine, people say, it's not just about me, it's also about everyone I love and those around me.
Yeah. Gloria, your thoughts.
Thank you very much for this wonderful presentation. It was a lot of great information, and I know our communities, our audience is getting a lot of details, a good message to take back to their respective communities. I think this is what we need. We need to empower them, enlighten them with a real fact, transparent information that they definitely go back to their communities and get what they needed to get to protect them from COVID and any other diseases.
Edward, it's up to you now. You got the power.
Would you call on?
Edward.
Oh, well, the whole conversation reflects the fact that leadership matters. Leadership matters in setting policy at the federal, state, local level, and leadership matters. So get out and vote.
Oh,
Yeah,
wonderful.
right.
Jocelyn.
Thank you so much today. Look, we must connect with the underserved, hard to reach, vulnerable, and vaccine hesitant population. We must stop underfunding public health. The money should follow the policy, not the policy should follow the money. Plain and simple.
I know why I voted for you now, all over again. Thank you.
You ought to go back and vote again, don't you? Maggie.
The ballot?
I'll vote for you. I'm just not in your jurisdiction, but you got my vote too. All
right. I'll take it.
We'll just take another 5 minutes to the big audience. We're running over just a little bit. But
okay, go ahead. Let's go. Maggie.
Maggie, you're a millennial. Go ahead, Maggie.
I just want to say, I think this has been a really amazing conversation. There have been so many great points that have been brought up. So I think it's going to be really great for all of us to go back to the community, our individual communities, to be able to spread the word that we've learned here.
Good. Ernest?
Just briefly, support public health, because public health is the protector of the population. So whether it's shots, vaccinations, or any time, public health needs to be elevated.
Trina?
Katrina, you're on.
You're on.
I'm sorry, I didn't hear you.
Okay.
I think we should just continue to practice the new CDC guidelines until we reach a vaccine that is available to everyone.
Dean?
4 critical factors: leadership, plus effective communication, plus health literacy, plus trust. Rebuilding or creating, right? Those 4 factors will change the world. Thank you.
Mike?
We'll skip Mike. He's going to close this out.
Okay. Okay.
Chinadu.
Just want to say I'm happy to have been present for this conversation. I've learned a lot, and I want to thank all of you for speaking and setting an example for the next generation.
Good, thank you. Millie?
I want to hear more from the influencers. I'd love to have more conversations with Katrina and Mike and really find out what they need and help them get it. We talked about those videos. I really hope that we find a way forward together to really bring the information out to the community.
Thank you, Millie.
Monica?
I would echo what Millie just said and just say that getting our message across and educating people is really important. And so we want to be a part of that conversation.
Duan?
Yeah, I would say I'd like to close out with saying that meeting people where they are is really important. And COVID-19 pandemic have taught us anything that with social distancing and psychologically is really important. We are amongst information war. So the best way to eliminate the bad information is to overpower it with the good information.
Mike?
Guys, I just thank you so much for letting me be a part of this panel. I've learned a lot. However, I would love to learn a lot more, because from the platform that I sit, I can change a lot of people's mind with the understanding of what's going on. So my mind, my brain right now is like a funnel, and I just want you to pour into it, and it's going to get in there, and then I will direct the correct information to the people, and then we can start to change from within, like the doctor said earlier.
And Mike, let me say this, because you made a comment with people feel embarrassed. And one of the things you should know, when I showed those clips to the class, they loved your style. You didn't judge people. You asked them a question, you listened to them, because you know you're going to see them again. And that's the lesson here. Because Mike and Katrina are going to see them again, there's an opportunity to move from where they are to a new place of understanding. So don't give up. And that's why we've asked Dr. Osterholm to read one of his podcast poems as he closes us out.
Well, thank you very much, Stephen. And I was going to do that, but I was so moved by tonight, I would like to just offer a few words.
Okay.
And that is that I learned much more tonight being with you than I ever could have imparted. You know, the older I get, the more vulnerable I am to learning. And tonight was a learning experience. But the one thing I would leave you with in that learning is that in the end, it doesn't matter how much information we share with people. If it's not done with a sense of kindness and a sense of cooperation and a sense of respect, it doesn't matter what you tell them, or it doesn't matter what they tell you. And so I'm going to leave you all tonight with a challenge. And that is the challenge of helping us to support this pandemic of kindness we need right now to take on the pandemic of COVID. And so every one of you on this screen, and I'll come find you otherwise, you have to do an act of kindness every day and keep doing it day after day after day. And I promise you, when you do that, your message is going to be much more well received. And in the end, we're all better for it. So thank you so much for having me. It was a real gift. I can't tell you how much I appreciate being with you. You've restored my energy for the week. Thank you.
Well, that's saying a lot. And Omar, let you take us out. You're all going to receive a link to the recording here and other resources. And we had over 194 people on with us tonight. There's still 104 people with us right now as we're speaking. Omar, take us out.
You know, what the world needs now is love, sweet love. It's the only thing that there's just too little of. You know, more is caught than is taught. People learn best by precept and example. And for each of you who, in your own way, freely imparted your knowledge and understanding of what impacts us all, we are eternally grateful to you for all that you do, both seen and unseen. There's an acronym for love, and it's merely LOVE, leaving others very encouraged. I am encouraged by your presence. Thank you for joining with us today. As always, as I say on my show, remember that I love you with a perfect love. But more importantly, remember this: you got the power. Have a great evening.
You got the power. Bye-bye. Till next time.
Thank you.
Thank you.